Hello, I'm Dr. Poojitha, fertility consultant at Akkineni Hospitals. Hope you're doing well. We'll be discussing some important aspects today. Stay through the session and note them.
Welcome to This Explainer. Today, we're diving right into the IVF process. Look, if you or someone you love is navigating the world of fertility, you already know how overwhelming the sheer amount of medical jargon can be, right? It's like learning a completely new language. So, we're going to break the whole thing down step by step to give you a clear, structured roadmap toward parenthood. Let's get into it.
Here's our roadmap for today. We'll be looking at the catalyst, the roadmap, the reality check, protocol customization, managing risks, and finally, your path forward.
All right, starting with Section 1, the catalyst, or the why behind IVF.
So, IVF is indicated for quite a few different starting points. For instance, if a patient has tubal factor infertility, which basically means blocked or damaged fallopian tubes, well, IVF completely bypasses the tubes altogether. For severe male factors, we can actually assist fertilization directly in the lab. It's also a highly effective intervention for stubborn endometriosis, ovulatory dysfunction like PCOS, or advanced maternal age. Identifying your exact catalyst is absolutely crucial here, right? Because it dictates exactly how your doctor will totally customize the rest of your protocol.
Moving on to Section 2, the roadmap, the 6 phases of IVF. You know, when you compress what feels like this massive, open-ended clinical process into a tight, 30-day chronological journey, it suddenly feels a whole lot more approachable. We've broken this down into 6 actionable phases over a single month. Let's zoom in and see what actually happens during these absolutely critical milestones.
The journey officially kicks off with Phase 1, which is ovarian stimulation. For the first 10 days, patients commit to daily hormone injections, specifically FSH. Now, this safely stimulates the ovaries into developing multiple eggs all at once. Then, once those mature, we move right into Phase 2, egg retrieval. This is a quick 15 to 20-minute ultrasound-guided procedure done under anesthesia. It's incredibly precise, really designed to get you in, out, and resting comfortably at home as fast as possible.
Then, on day 12, we hit fertilization. And this is where a literal game changer called ICSI comes into play. Now, in conventional IVF, sperm and egg are placed in a dish to fertilize naturally. But with severe male infertility, an embryologist will physically inject a single healthy sperm directly into the egg. I mean, this level of precision is a massive leap forward. It actually bumps fertilization rates from the standard 30 to 50% range all the way up to 70%. Huge difference.
Entering Phase 4, the embryos are cultured in a tightly controlled lab environment. We basically monitor them for up to 6 days until they reach the blastocyst stage, which is an embryo with over 100 cells. Now, I know this waiting period can be super nerve-wracking, but it's essential. Culturing to this specific stage actually acts as a natural selection process, and that yields significantly higher pregnancy rates. Finally, in Phase 5, the absolute highest quality embryo is gently transferred back into the uterus. The whole shebang takes just 5 to 10 minutes and literally requires zero anesthesia.
Okay, let's jump into Section 3. The reality check, success rates. So what does the data actually tell us? Well, maternal age is hands down the single most important factor affecting your success rate per cycle. The numbers are pretty clear. For women under 35, the live birth rate per cycle sits right around 40 to 50%. That steps down to 30 to 40% for ages 35 to 37, and then 20 to 30% for ages 38 to 40. Now, knowing about this natural decline isn't meant to be discouraging at all. Actually, it empowers patients to make timely, highly informed decisions about their own personal timelines.
Now, if those previous numbers felt a little daunting, I want you to focus on this one, 80%. In reproductive medicine, persistence really pays off. While a single cycle might have a 30 to 40% success rate, your cumulative chance of pregnancy jumps massively, up to 60 to 80% when you plan for a 3-cycle horizon. You see, IVF is rarely a one-and-done event. Viewing it as a multi-cycle journey, that completely changes how we define success.
All right, Section 4, customization, personalizing your protocol.
Because every single patient is wonderfully unique, your doctor basically becomes a strategist here, choosing between different medical timelines. The two most common are the long GnRH agonist protocol and the short GnRH agonist protocol. The ultimate goal is perfectly optimizing your specific ovarian response, and they base this on your age, hormone levels, and your personal medical history.
So here's the trade-off.
The long protocol is kind of the classic approach. It offers superior cycle control and prevents premature ovulation, which drastically lowers cancellation rates. The catch? Well, it takes 5 to 6 weeks and requires a lot more injections. The short protocol, on the other hand, starts right with your cycle. It demands fewer injections and is generally more cost-effective. But because it offers slightly less control, it carries a slightly higher risk of the cycle being canceled. Your medical team will weigh these exact pros and cons against your unique biology to figure out what's best for you.
Next up is Section 5, Weathering the Journey, Managing Risks.
Just like any big expedition, we have to prepare for the conditions. One of the primary risks in IVF is ovarian hyperstimulation syndrome, or OHSS. This happens when the ovaries overrespond, which causes fluid shifts and painful abdominal bloating. But here's the really important takeaway. Modern fertility medicine is incredibly proactive about this. Doctors prevent serious OHSS by highly individualizing your initial medications, tracking your daily blood work, and even swapping the type of trigger injection used at the very end. This helps virtually eliminate the risk before it even starts.
Now, historically, IVF was strongly associated with multiple pregnancies, twins or triplets. And while that might sound like great 2-for-1 efficiency, carrying multiples actually drastically increases maternal complications and neonatal ICU stays. In fact, transferring 2 embryos carries a 20 to 40% risk of a multiple pregnancy. Because the ultimate goal is always a healthy baby and a healthy mother, single embryo transfer, or SET, has thankfully become the protective, modern standard of care across the whole industry.
Finally, we arrive at Section 6, the guide, your path forward.
The truth is, navigating IVF is definitely not something you have to do alone. Expert facilities like Akkineni Hospitals provide a totally comprehensive umbrella of care. You aren't just getting an initial evaluation, you're getting individualized cycle management that's tracked daily by doctors and nurses. You're backed by advanced embryology labs with super strict quality controls, and vitally, you receive dedicated emotional support. They make sure you are held through every single step of what can absolutely be a mental and physical roller coaster.
So we've looked at the timelines, the hormone protocols, and the hard statistics. But all of this data really leaves us considering a pretty profound final thought. When precise clinical data and advanced medical protocols perfectly align, where does the science end and the deeply human hope of starting a family begin? IVF is absolutely a marvel of modern medicine, but at its core, it's simply a bridge built by science to fulfill a timeless human desire. Thank you so much for joining me on this explainer today.